You guys ready? Okay. Well, thanks everyone for joining. This is the city's weekly COVID update. It's July 1st, new month. In the last 7 days, we've had in Pennington County 48 new COVID-19 cases. We see in the hospital, statewide hospitalizations are down about 30% from last week. So as of today in Pennington County, the total number of cumulative cases since the beginning of the pandemic is 523, but the current active cases in Pennington County is 130. So the chart here to my right shows the blue as the total cumulative cases. We see that number still going up daily by typically single-digit numbers at this point. And the orange is the current active cases. And that is coming down because of the rate of recovery being slightly higher than the rate of new infections. So that's why we see a downward trend in the orange. This is a simple statistical update. It's one chart. It doesn't really speak to the reality of the global pandemic or how it's affecting us in South Dakota. There's been over 90 South Dakotans who've lost their lives to COVID-19, several of those from Pennington County. And the reality is we're not safe yet. This is still an ongoing health threat. And I think the jury is in on what we should be doing. I think it makes good sense for us to be wearing masks when we're going into public places, especially indoor places, and especially places where we cannot control the distance between us and other people. Yes, it's true that no surgeon wears only a cloth mask to do a surgery. They are not the same quality as an N95 or some other type of sophisticated breathing filter, but they do stop or reduce respiratory droplets. They will protect you and others when you're in a crowded place. And I think we should get used to this. So our EMS, emergency medical service calls, the respiratory calls are down this week by about 10%. Our city workforce is healthy. We still have 2 employees out recovering from COVID-19. And so by now, this is July 1st, we started these briefings in March. By now you're figuring out, and if not, you should be figuring out that there is not a near end in sight to this pandemic. It is lingering. And part of the reason for that is that we've done a good job being safe. We have, you can see from this, you can't really use the term flatten the curve anymore. We're still ascending to our peak, but what we are seeing is a very slow ascent. And that means that we are also pushing out the duration of the infection spread in our community. That's the way it works. If we were to all get together and spend a few hours around each other face to face, we could probably accelerate both the curve and maybe even the speed of recovery. However, not everyone, as we know, will recover. So we're doing the right thing, in my opinion. We're drawing this out as long as possible. We're keeping our hospital beds open as much as possible, and we're using those hospital resources as efficiently as possible. Meanwhile, with every day and week and month that goes by, we as a global community and even locally, we learn more about the virus, learn more about the behavior. Several countries now are under vaccine testing, including the United States. That doesn't mean we're going to have a vaccine by next week. These tests really will take a while to prove their effectiveness. And so we're in this for the long haul. The COVID relief fund funds are being processed. There's an application process through the state for which we will ask for reimbursement for COVID-related expenses, as well as public safety personnel costs. So we don't have these dollars in our pockets. This is not a quick and easy solution to the declining sales tax receipts we've seen here at the city. This is not a cure for the city's financial woes. We're still in the middle of this pandemic. Spending is still down, so we're still experiencing that loss of expected revenue. So we will come to the City Council with a responsible plan on how to utilize the eventual COVID relief funds, but that time is not right now. The Civic Center has begun hosting some small events. They will be hosting these events in July and August, and they're hoping for more public ticketed events in the fall. We are now currently watching other locations around the country, including in South Dakota, watching how they are reopening their entertainment venues, what precautions they're taking, what type of entertainment acts, and we'll get to see the success in their practices and what works. So that's what we're doing right now, is we're studying how other communities are opening up for entertainment. At some point, though, we will have full house, shoulder-to-shoulder events, almost just like the old days, and it will likely be before the end of the pandemic. We just can't say for certain right now. As it's started in March for us, and now it is in July, we are projecting out when we think the statistics and when we think the procedures and the vaccine and everything else we can imagine, when that will give us a clearer idea of how to behave in the future. So obviously with entertainment, entertainment is discretionary. We don't have to go out to a concert, we don't have to go to a convention, we don't have to do any of that type of thing. We can sit home in our living room if we choose to. The fact of the matter is the people in our community and communities across the nation are choosing not to. So some risk management will be needed, of course, when we start to hold public events, and that'll be risk management on the part of the venue and also risk management on the part of each individual person. In our transit system, we will likely shift back to normal weekday hours starting the week of July 13th. We're not anticipating resuming Saturday service yet because we are struggling a bit with the size of the workforce, the readiness of that workforce. COVID has taken a few of these folks out of the game temporarily with illness, but it's also shaken the confidence of some as well. So we are going to evaluate that day by day. Our emergency shelter, which is currently at the Civic Center in the Rushmore Room, the daily census today is five people, 3 of which are COVID-19 victims. The shelter move date is now July 7th, and that's the day when we'll move this shelter operation from the Civic Center up to a building owned by the county at 725 North La Crosse. This is the old detox building, the City County Alcohol and Drug Treatment Center. So we'll be moving up there possibly for the duration. Our July 3rd events coming right up. We will be working with other local, state, and federal agencies to ensure security. Obviously, we have some high visibility events here with the President coming to Mount Rushmore, several other dignitaries coming to town in and around Rapid City. And so I'm just going to ask all of you to please do not waste precious public safety response time by engaging in illegal activities such as large fireworks. I know that's going to happen. It happens every year, but the more you take that risk, especially when you're more likely to irritate the neighbors after bedtime, the more likely we're going to get a response from a police officer who may desperately be needed elsewhere. So your reckless behavior, if you choose to participate in it, could cost someone else dearly. It could be just a delayed response, or it could be a greater threat to their safety or their life. So we have a lot going on this week. Our building permits continue to be very strong. We're starting to see the re-emergence of commercial building permits now. The majority of them through the pandemic have been residential. So we're seeing a bit more confidence in the commercial investors and builders, which is a good sign for us. Again, everything I've said does not say we're out. We're back to 100% normal activity, nothing to worry about, but we are on the road to recovery. So if there are any questions from anyone in the room, I'd be glad to take those now.
Dave Kidd, News Center 1. How are preparations going for Friday's Mount Rushmore event?
Well, they're going well, but the resources needed are very, it's daunting. The volume of resources, the length of that those resources will be in use, it's a big deal. And so between managing the special events and our normal health and safety here in the community, it's going as well as it can be. I promise July 3rd and July 4th will come and go. Enjoy it while it's here, because the calendar never stops. We'll be on the other side of this pretty soon. And at that time, I'll be able to accurately let you know how it went. But as for now, we think it's going just fine.
And do you have any public health concerns going into this event, as well as into the Independence Day holiday and the celebrations that would go along with that?
Well, of course. We're going to have thousands of people face-to-face, shoulder-to-shoulder at these events. Someone who's been waiting in line to see a president, if not this president, and also getting to see fireworks at Mount Rushmore, is probably not likely to disqualify themselves because they develop a cough the day of or the day before. So I think that, yeah, it's obviously an apparent health risk, but I'll let you know in a couple of weeks after if it was really a health risk, because between that and the other special events we have here, if in fact it's going to cause infection, we should be seeing those results within a couple of weeks. So we're all crossing our fingers. Our public safety employees always take precautions. In fact, it was brought up today that the fire department, who runs the ambulance service, the emergency medical service, their employee sick leave is in better shape this year than it was a year ago. So all of these safety procedures are, in fact, keeping employees healthy. Any other questions from the room? All right, well, thank you for coming. Appreciate it.